Hey there, this is Dr. Linda Burke. I'm a board-certified OBGYN physician, but I'm not going to be talking about OBGYN today. Imagine that you are a parent. You bring a child into the world, and then 33 years later, you have to bury that child because the cause of death is suicide. Their son was a third-year ophthalmology resident at the George Washington Hospital. He was doing his residency training, and unfortunately his body was found back in March in his apartment with a suicide note that basically talked about his challenges and frustrations during his residency training and his concern for his fellow residents. Now, why am I talking about this? I don't know this young man. Our paths would probably have never crossed. But the reason I'm talking about his suicide that happened back in March, the reason I'm talking about his suicide is because his death is a clarion call for the disarray of our healthcare system. I don't know if you all know this, but physician burnout is real. Every day, more and more physicians, I believe the number is 1 out of 5, are leaving the profession. I'm retired. Other colleagues are. I retired fairly early because of physician burnout. Other colleagues are changing professions, and other people are simply no longer interested in becoming a physician. And this is a public health crisis because the less physician workforce we have, the greater the risk of the public being in harm's way. Long story short, I am asking the public to help us prevent more deaths, more suicides like Dr. West. I don't know if you realize this, but every year 300 to 400 physicians commit suicide, which is double the normal population. 2 out of 5 physicians screen positive for depression and anxiety. And it wasn't always that way. A lot of it, you may ask Dr. Burke, why? What's going on? What's going on is that physicians are now providers. And there is a horrific demoralization of healthcare staff. And there is an emphasis on you as a healthcare profession being a revenue generator as opposed to being a professional and a healer. What can the public do? First and foremost, you can ask people to become accountable. You can demand accountability for people who are in charge, for people who make decisions, for people who approve nursing shifts where a nurse is supposed to have a patient ratio of 1 to 3, but it's 1 to 6, where you encounter a physician or a resident who is fatigued and not attentive and misses your diagnosis. This is why it is so important for the public to become involved. You can develop oversight, independent oversight committees. You can talk to C-suite decision makers in healthcare systems. You can talk to and demand responses from people who sit on hospital boards. Michelle Obama said, do something. And that's what I'm saying. We need to do something. And again, healthcare professionals are not in a position to do something because many of them are afraid. I'll just be real with you. They're afraid of surveys, they're afraid of retaliation, they're afraid of losing their job, they're afraid of, quote, ruining their career. it's important for you to get involved because we need to put the care back in healthcare. Thank you for listening, and I will see you next time.
Don't play with it, don't be dishonest. Ay, still not understanding.